So the thing with the eyes is that most often we kind of take it for granted because you wake up, you can see, so you think everything is all right. But it's a shock how many conditions there are of the eye.
Dr. Antwi, welcome to Day Spring Life and Health.
Thank you so much. Thank you so much for having me.
She's been practicing for at least the last 10 years, an optometrist, and currently in her own private practice in West Hartford, Connecticut. Do you suggest that at least everybody gets a yearly eye exam?
Yes.
Okay.
So the thing with the eyes is that most often we kind of take it for granted because you wake up, you can see, so you think everything is all right. But it's a shock how many conditions there are of the eye. A colleague of ours counted, and there are over 250 different conditions that affect the eye. So we always advise yearly exams. A joke that I tell my patients is, if you go to the dentist twice a year for cleaning for your teeth, then you can at least come to your eye doctor once a year, because we all know you can lose a few teeth, but if you lose your eye, it has much more greater consequences. So
I didn't even think about it that way. You can sacrifice some teeth, but you can't sacrifice an eye.
No, because although you have to, even if you lose one, the consequences are still. So that's what we always advise, that always yearly exams, because if everything is fine, what we'll say is, okay, we'll see you next year.
Wow. Okay, the next question: what specific foods or food groups do you suggest for people to boost their eye health, and in particular also for patients with diabetes?
So when it comes to foods, as we all know, avoid, heavy carbohydrate diets, also the fatty foods, also, high sodium, salty foods, processed foods. Avoiding all of those is just healthy for your overall health. But when it comes to the eyes, what we advise is, foods that are high in antioxidants. So spinach, kale, collard greens, beets, anything that has a high antioxidant content is excellent for the eyes. Also flaxseed, omega-3s, the healthy fats, also very, very good for the eyes. And then overall, again, cutting down on your carbohydrate intake, cutting down on your processed foods, just to maintain a healthy body, because, a healthy eye will reside in a healthy body. You could have a great pair of eyes, but if your body is giving you problems, what's the use? And so just making sure that your overall health is, tip-top shape, and then that will also in turn translate to a healthy eye.
Do you have any suggestions for vitamins too for eye health? Do you have any unique ones?
So there are specific vitamins that are good for the eye. Usually, before, I would say, there would be vitamins just like, the Centrum and all of that. But most are not tailored specific to the eye. But now, of late, there are pharmaceutical companies that have taken up the challenge and are making vitamins specific for the eye. One that I recommend to my patients often is called Macu Health, MACUHEA. LTH. And what that contains, so through research, we have found that in the macula, there are three components that is not found anywhere. There is lutein, zeaxanthin, and mesozeaxanthin. Normally, lutein and zeaxanthin we are able to find in our diet by eating egg yolk, milk, things like that. We're able to get those vitamins in our body. The only one we can't make or get from food, I should say, is mesozeaxanthin. And so there are some companies through research that have been able to formulate that. And so I recommend MacuHealth a lot, not just for those who have, issues with their macula, but just to maintain the overall health. And I've had, testimonials from patients who've taken it, and then they'll come the following year and say, wow, I've noticed that I'm able to appreciate, even contrast, how well you're able to tell the depth of color. You'll be surprised as time goes on when you start to lose that. Another company also makes eye vitamins they call Eye Promise, like EYE Promise. And they also have a slew of different types of vitamins from that company. Some, for maintaining the macula, some for dry eye. But those two companies, I would say, would be what I recommend. Because if not, most often what people are taking is just, just a very minimal benefit to the eyes, and it's just, expensive vitamins. But
very expensive. I have some names, but I don't want to be in trouble with.
I know.
So I'm not going to mention, but very expensive eye products. Yeah. And when you look on the bottle, all they got is vitamin A.
Exactly.
Maybe lutein, and that's all you get. So I'm going to look those up, and if I'm able to find them, I'll put links on the description of the video. And do you have some in your practice setting too? The practice?
Yes, we do. We stock these vitamins so that those that need to purchase them, they're able to get it directly from us. Just because of getting it directly from the manufacturer, usually the pricing difference is much less in our office than or in doctors' offices than you would find on Amazon or even on the website.
Well, good to know. So I'm going to hook up with you and see if I can get some for people who will reach out to me on the channel for that. And those people who are local, they are going to have to find out where you are. And that actually leads us to our next question. Talk about Eyes on Park and what you do there, and how can people get to you if they need to talk to you or if they need to come and get their eyes checked.
Okay, so Eyes on Park is a private optometry practice, full service. We do everything eye related except surgery, because eye surgeries cannot be done in an office. It has to be done at a surgical center. But from, checking eye health or the different conditions of the eye, managing eye conditions, to fitting contact lenses, all the different types of contact lenses, specialty lenses, to providing eyeglasses. We're able to, serve our patients with all of that. We are in West Hartford, Connecticut, on Park Road, hence the name, Eyes on Park. And usually we're able to, accommodate most of our patients, those that need, our help. It's myself and then another doctor that work there seeing patients.
I see. And if anybody wants to get to you, I will collect all that and put it in the description, so that if somebody wants to email you, because I'm pretty sure there are some people who are going to watch us from far away, they can't come to West Hartford. But those who are local in Connecticut, they got to come and check you out, including me. I'm going to be there. All right. Before we end this video, what would you like to say to viewers?
The closing remarks I'll have leaving with everyone is take your eye health seriously. Make sure you're getting your yearly eye exams, because that is very, very important. That's the only way we're able to keep track, monitor, and also detect changes that happens to the eye. If you've been diagnosed diabetic, then maintaining your sugar levels, making sure that you're following the treatment protocol. If it's insulin, making sure that you're taking your insulin and you're not either spiking or dipping when it comes to your blood sugar. That would be the only way we can maintain your eye health for the years to come without any complications.
I want to say thank you also to Dr. Antwi-Nartey for her time and for such an insightful discussion, very detailed. Hopefully those with diabetes are going to take it more serious and also put more seriousness into their eye exam and eye health. All right, thank you, doctor.
Thank you, my pleasure.
Beloved, I wish above all things that you prosper and be in health, even as your soul prospers.